If you're a senior, or you love someone over the age of 60, I need you to listen very closely for the next few minutes, because what I'm about to share could genuinely save a life. There is a specific type of pain so common, so easy to brush aside, that often appears just hours before a heart attack. Most people ignore it. Most people assume it's nothing. But seniors, especially, cannot afford to dismiss it. And the truth is, this warning sign shows up far earlier and far clearer than most people realize. As we start this video, I want you to imagine something for a moment. You wake up one morning, maybe feeling a little off. There's this brief discomfort in a part of your body you're not used to feeling pain in. It's not intense enough to scare you. It's not dramatic. It's not like what you see in movies. It's subtle, just annoying enough to make you notice. And what do most people do? They stretch, they move around, they assume they slept wrong, they blame it on age, they wait for it to pass. But what if that small pain ignored, brushed off, overlooked, was actually the early sign of something much more serious happening inside your body? What if that small pain was your heart whispering before it starts screaming? When it comes to heart attacks, most people immediately think of chest pain, right? The classic image we see in movies or on TV is someone clutching their chest, gasping, and collapsing, and that's what most of us expect to feel. But for seniors, the story is often very different. The early warning signs of a heart attack are rarely that dramatic, and that's what makes them so tricky and so dangerous. One of the most important things to understand is that heart-related pain in older adults often shows up in places you might never suspect, and if you only watch for chest pain, you could easily miss these signals. Many seniors first experience discomfort in their left arm, and it's not always the full arm that hurts. Sometimes it's just a heaviness or a dull ache in the shoulder, the elbow, or even the wrist. It can feel like a muscle strain, like you lifted something wrong, or like you slept in an awkward position, and because it's mild or unfamiliar, it's easy to dismiss. But what your body is actually doing is sending a warning from the heart. The nerves in your heart and left arm share the same pathways to your brain, and when your heart is struggling, the signal can be misinterpreted, making the pain appear in the arm instead of the chest. This is especially common in seniors because as we age, the nervous system changes, and the way pain is transmitted and felt can be very different from when we were younger. Another place the pain can show up is the jaw, often on the left side. You might feel a pressure, a tightness, or a strange soreness that feels like a dental issue, but it isn't. Many seniors experience this jaw discomfort hours before a heart attack, and because it mimics toothaches or other minor dental problems, it's often ignored. The nerves around the jaw and heart are closely connected, and the body sometimes mixes the signals. So, a seemingly small or unusual ache in the jaw could actually be your heart trying to tell you something urgent. Upper back pain is another sneaky signal that gets overlooked. Seniors often blame it on posture, arthritis, or just sleeping wrong, but a sudden tightness, burning, or pulling sensation between the shoulder blades can also indicate heart trouble. This upper back pain happens because the nerves in that area respond to stress in the heart, and sometimes it's the only warning some people get. What makes all of these warning pains tricky is that they don't always feel severe at first. They can appear intermittently, and they don't always look or feel like what you expect a heart problem to feel like. The reality is, your body is constantly communicating with you. Every ache or unusual sensation is a message, and seniors need to pay close attention to these subtle signals. Knowing that heart-related pain often shows up outside the chest, in the left arm, jaw, or upper back, is crucial because it gives you the chance to recognize danger early. And recognizing it early means you can act fast, seek medical help, and potentially prevent a full-blown heart attack. Most seniors brush off these aches because they don't seem serious, but learning where and how heart pain manifests is one of the most powerful tools you can have to protect your health. One of the reasons heart attack warning signs are so dangerous for seniors is that the pain often comes and goes. And this on and off nature tricks people into thinking everything is fine. You might feel a sudden discomfort in your left arm for a few minutes, or a strange tightness in your jaw that vanishes almost as quickly as it appeared, and it's natural to assume it's nothing. Maybe you stretch, shake it off, take a sip of water, or go about your day thinking, "That was weird, but it's gone now, so I must be okay." But the truth is, intermittent pain is often a signal that your heart is struggling to get enough oxygen and your body is trying to alert you before the problem becomes critical. This kind of warning is subtle, quiet, and easily overlooked, which makes it especially important for seniors to pay attention. Unlike the sudden, dramatic chest pain we imagine in movies, the heart sends signals in intervals, and those intervals can last hours. The pain might flare up while you're sitting quietly, then disappear when you move or rest, making it feel almost harmless. That's why many seniors delay seeking help, thinking that if the pain isn't constant, it can't be serious. But this is one of the most common mistakes that leads to emergencies. Pain that comes and goes can show up in many different ways. Sometimes it's a dull ache that appears in the left arm or shoulder. Sometimes it's a pressure in the upper back, and other times it's a brief discomfort in the jaw or even the upper abdomen. The intensity isn't always the same either. You might feel a mild heaviness that's easy to ignore, and then suddenly a sharp twinge that makes you pause. This inconsistency is part of what makes it so confusing. For seniors, the nervous system changes with age, which can make the heart's signals weaker, delayed, or misdirected. That's why an early warning might feel like a small passing pain instead of a full-blown crisis. Your body is trying to communicate, but it does so in whispers rather than shouts, and the challenge is recognizing that whisper before it escalates. Another aspect to keep in mind is how other subtle symptoms often accompany these intermittent pains. Sudden fatigue, slight shortness of breath, cold sweats, or an uneasy feeling in your chest or jaw may appear only at certain times. They might fade just as quickly as the discomfort, and that pattern can lull you into a false sense of security. But the combination of fleeting pain with these other signals is exactly what makes them critical to recognize. It's your body giving you a window of opportunity, a chance to act before a heart attack happens. Seniors who understand that these intermittent, seemingly minor pains are not normal are much more likely to get help in time and prevent serious damage. The key message here is simple but often ignored. Pain that comes and goes should never be dismissed, especially in seniors. It's easy to convince yourself it's minor because it isn't constant, but that's exactly what makes it dangerous. These passing sensations are your heart's way of trying to get your attention, and recognizing them early can mean the difference between a manageable emergency and a life-threatening event. By paying attention to these signals and acting quickly, you give yourself the best possible chance to stay safe, protect your heart, and respond before things get worse. One of the most overlooked aspects of heart attack, warning signs for seniors, is how subtle and unexpected they can be. It's not always about sharp, obvious pain. In fact, many seniors experience a variety of subtle symptoms that are just as important to recognize as physical pain. Fatigue, for instance, is one of the most underestimated early indicators. Unlike the normal tiredness you might feel after a long day, this fatigue comes suddenly, without warning, and it hits harder than usual. You might find yourself struggling to do simple tasks that normally feel easy, or feeling drained after minimal activity. Some seniors describe it as a wave of exhaustion that seems to come out of nowhere, leaving them weak or unsteady. This kind of fatigue happens because the heart is not pumping efficiently, and your muscles and organs are not getting the oxygen they need. Your body responds by slowing down and signaling that something is wrong, but because fatigue is such a common part of aging, it's often dismissed as just getting older or not sleeping well. Shortness of breath is another subtle warning sign that often goes unnoticed. You might notice it when walking across a room, climbing a few stairs, or even while sitting at rest. It can feel like your lungs aren't getting enough air, or like you're breathing faster than normal without exertion. For seniors, this can be especially misleading because mild breathing difficulty is sometimes attributed to age, reduced stamina, or existing respiratory conditions. But when shortness of breath appears suddenly or unexpectedly, especially alongside mild discomfort in the arm, jaw, or back, it's a red flag that the heart is struggling to deliver oxygen-rich blood. Ignoring this signal can be dangerous because it often precedes more severe heart problems. Cold sweats, nausea, and a general sense of unease are also subtle symptoms that should not be overlooked. You might feel clammy or dizzy for no apparent reason, or notice queasiness that doesn't feel like regular digestive issues. Some seniors describe a feeling of impending doom or anxiety without any obvious cause. These emotional and physical cues are the body's way of signaling stress in the cardiovascular system. It's important to understand that heart attack symptoms in older adults can be very different from the dramatic signs portrayed in popular media. Seniors often experience a combination of mild, unusual, and fleeting sensations that can easily be mistaken for minor issues. But when these symptoms cluster together, they're your body's early warning system. Recognizing these subtle signs requires paying attention to changes in your normal patterns. If you suddenly feel more tired than usual, notice unexpected shortness of breath, experience a fleeting pain in your arm, jaw, or back, or feel generally unwell for no clear reason, it's time to take action. Seniors often brush these feelings off as normal aging or minor discomfort, but in reality, these are signals that your heart may be under stress. Acting quickly and calling for medical help when these symptoms appear can make a significant difference in outcomes. Awareness, attentiveness, and prompt response are key to preventing serious heart complications. By listening to your body, observing these subtle signs, and responding without delay, you increase your chances of catching problems early and keeping your heart safe. Timing is everything when it comes to recognizing a heart attack in seniors, and one of the most important things to understand is that the warning signs often appear hours, and sometimes even a full day, before the actual event. Many people think heart attacks strike suddenly and without warning, but in reality, the body often gives clear signals in advance. For seniors, these early signs can show up as subtle discomfort in the left arm, jaw, upper back, or even the chest, along with mild fatigue, shortness of breath, or nausea. The challenge is that because these symptoms aren't intense or dramatic, they're often dismissed, and precious time can be lost. Understanding the timing of these early warnings is critical because it creates a window of opportunity to seek help before the situation becomes life-threatening. The heart needs oxygen to function properly, and when blood flow is restricted due to plaque buildup or a developing blockage, your body begins to signal distress. But in seniors, these signals are frequently less obvious than in younger adults. The pain or discomfort can come and go, varying in intensity, and appear intermittently over several hours. That means you might feel a brief twinge in your arm, then nothing, then another sensation in your jaw or back. Each of these moments is a chance for intervention, but only if you recognize them as serious and act. This early period is the body's way of trying to communicate with you, giving you a chance to respond before the heart suffers permanent damage. Many seniors make the mistake of ignoring these fleeting symptoms, thinking they're minor or temporary, or blaming them on age, stress, or fatigue. But every small signal counts. For example, a dull ache in the left arm that fades after a few minutes isn't harmless. It could be a precursor to a major blockage forming. A brief tightening in the jaw or pressure in the upper back that disappears may seem insignificant. But combined with mild fatigue or shortness of breath, it's part of a larger pattern that points to your heart. The timing of these signs is crucial because heart attacks rarely happen without warning, and these early signals are often the body's last chance to alert you before a serious event. Recognizing these patterns means paying attention to changes in your body that are out of the ordinary. If you notice discomfort that appears in cycles, if you feel more tired than usual, or if minor aches seem to move from one area to another, it's essential to treat these as potential red flags rather than coincidences. Acting within this early window, calling emergency services, getting checked by a medical professional, and monitoring your symptoms can dramatically improve outcomes. Seniors who understand this timing and respond immediately have a much higher chance of avoiding irreversible heart damage. It's also important to communicate with family or caregivers about what you're feeling. Sometimes the early warning signs are subtle enough that you might question them, but having someone else observe your symptoms or accompany you to a hospital can make a life-saving difference. Understanding that these signs appear hours in advance allows you to take action proactively rather than reactively, giving your heart the best chance to recover and reducing the risk of severe complications. Awareness of timing is a form of empowerment. By recognizing that your body often signals trouble hours before a heart attack, you give yourself the ability to intervene, protect your health, and respond before it's too late. One of the most critical points seniors need to understand is that immediate action can save lives when early heart attack warning signs appear. Too often, people delay seeking help because the symptoms aren't intense or because they convince themselves it's nothing serious. You might feel a twinge in your left arm, a fleeting ache in your jaw, or a sudden wave of fatigue and think, "I'll wait a little while, maybe it will pass." But every minute counts when the heart is under stress, and waiting can turn a manageable situation into a life-threatening emergency. Seniors in particular need to remember that their bodies communicate differently as they age, and subtle signs shouldn't be underestimated. Acting quickly, even if you're unsure, is far better than waiting and risking irreversible damage or worse. The moment you notice unusual discomfort or symptoms like left arm pain, jaw pain, upper back tension, sudden fatigue, shortness of breath, or cold sweats, you need to take them seriously and contact emergency services immediately. Time is the most valuable tool in preventing a heart attack from becoming catastrophic, and recognizing the urgency is a form of protection that can make all the difference. Calling for help doesn't just protect your heart, it protects your overall health and improves recovery outcomes. Medical professionals are trained to identify early signs, administer interventions, and stabilize your condition before it worsens. By acting quickly, you're giving them the best chance to prevent major damage and improve your chances of survival. Seniors sometimes hesitate to call because they don't want to bother anyone. They think they're overreacting, or they worry about being embarrassed if it turns out to be nothing. But when it comes to your heart, overreacting is the safe choice. Seeking help promptly is not a sign of weakness or unnecessary concern. It's a sign of wisdom, awareness, and self-care. Every moment you wait can allow the heart to become deprived of oxygen, which can lead to permanent tissue damage, complications, or a full-blown heart attack. Acting immediately is your best defense. It's also important to know how to respond while waiting for help. Sit upright rather than lying down, which helps blood flow and eases breathing. If your doctor has previously approved it, taking an aspirin can help prevent further clotting in the arteries, but only do this if it's safe for you. And if someone is with you, communicate clearly about what you're feeling so they can assist and ensure emergency responders have accurate information. Even a small delay in recognizing the severity of your symptoms can have a huge impact, so taking immediate action is truly non-negotiable. Seniors who understand this and act decisively give themselves the best chance of avoiding severe outcomes and ensuring that their heart and body are treated in time. Awareness, rapid response, and not underestimating early signs are the pillars of protecting your heart. By internalizing this approach, you're not just reacting to symptoms, you're proactively defending your life, giving yourself the opportunity to survive and recover with minimal complications, and empowering yourself with knowledge that could make the difference between life and death. Prevention and awareness are the true foundations of heart health, especially for seniors. While recognizing early warning signs and acting immediately is essential, the best strategy is to reduce your risk before those signals ever appear. Heart attacks don't happen out of nowhere, and many factors, both controllable and uncontrollable, contribute to the likelihood of an event. Regular checkups are an absolute must. Visiting your doctor routinely allows you to monitor blood pressure, cholesterol levels, and blood sugar, all of which play a major role in heart health. These tests help identify problems before they escalate, giving you the opportunity to make lifestyle changes or receive treatment that can prevent a serious cardiac event. Seniors often underestimate the value of these checkups, thinking they feel fine or that age is just going to take its natural course. But the reality is that prevention starts with knowledge. Knowing your numbers and tracking them over time can make a huge difference in detecting risk factors early. Alongside medical monitoring, lifestyle adjustments are crucial. A heart-healthy diet, rich in fruits, vegetables, lean proteins, and healthy fats, helps maintain proper blood pressure and reduces plaque buildup in the arteries. Reducing sodium intake and avoiding processed foods can further protect the heart. Regular physical activity, tailored to your abilities, strengthens the cardiovascular system, improves circulation, and helps manage weight. Even gentle exercises like walking, chair yoga, or swimming can make a noticeable difference in heart function over time. Avoiding smoking and limiting alcohol are equally important, as both can strain the heart and increase the risk of blockages or irregular heart rhythms. These habits might seem small individually, but together they create a strong defense that keeps your heart healthier for longer. Awareness also means paying attention to your body every single day. Seniors should know their baseline, how their body normally feels during activity, rest, and sleep, so that any unusual symptoms are immediately noticeable. If a new ache, pressure, or fatigue appears, it should trigger a conscious evaluation rather than dismissal. This awareness extends beyond physical signs. It includes emotional and mental health, as chronic stress, anxiety, or depression can also strain the heart over time. Simple stress management techniques, such as deep breathing, meditation, or spending time in nature, can positively influence cardiovascular health. Staying socially connected and engaged can also help reduce stress and improve overall well-being, indirectly benefiting heart health. Finally, prevention is strengthened by education. Seniors who understand the subtle ways heart problems can present themselves are more likely to respond quickly and appropriately. Learning about early warning signs, understanding risk factors, and actively monitoring your health are all forms of empowerment. They give you control over your well-being and help you take proactive steps to protect yourself. By combining medical checkups, lifestyle choices, and body awareness, seniors create a comprehensive approach that reduces the likelihood of a heart attack and enhances quality of life. This proactive mindset not only improves survival rates, but also fosters confidence in managing your health, ensuring that if a warning sign ever does appear, you're prepared to respond immediately and effectively.